Well, earlier this week, I brought you along for my initial visit with the orthopedic surgeon to my actual knee replacement surgery. After leaving the hospital, I went straight home for an intensive rehab program. In the final segment of my series, you'll get an up-close view of the first 2 weeks of that journey. Rehab begins in the hospital and continues at home for the first few weeks. A health nurse and physical therapist make house calls to make sure everything is in order.
It's very important to clear the pathway, the surrounding where the patients go, usually bedroom to the restroom. We need to clear that. The electrical cords that you use to hook your ice machine, because you could easily trip on them and then fall.
Certain necessities are needed, many of which are not covered by insurance. Those include a special bath chair to get in and out of the tub, a toilet seat with handrails, an aerobic step to get into the bed, a leg lifter to assist while gaining strength back, and a reacher for those hard-to-get items. Insurance usually covers these items to take from the hospital: compression stockings to prevent blood clots, an ice machine to keep swelling down, and a continuous passive motion machine, or CPM, a mechanism that keeps the leg constantly bending and extending. Patients with total knee replacements are supposed to use this machine a minimum of 2 hours in the morning and another 2 hours at night.
So you got to do this one and the one where we put the bolster under your knee and lift your leg, where you did poorly.
Yeah.
Okay, so keep doing it. Everybody knows this who had the knee surgery. When you go upstairs, you lead with a good leg, and then when you're going downstairs, you go down with a bad leg first.
About a week after surgery, I had progressed from a walker to 2 crutches outdoors and a cane indoors. Since my house has multi-levels, learning to climb steps was an important part of my rehab.
Well, fortunately for the lower extremity, it's fairly simple. You're working on quadriceps, which is the big muscle that's kind of your shock absorber, okay? And then calf muscles and some of the other muscles around the knee to get their strength back and flexibility.
To my patient, I generally want them to get to 90 degrees in the first 2 weeks. Ultimately, we want to bend your knee close to what the other knee has been doing.
Extending the knee is equally important. Without a straight leg, you may walk with a limp.
So I'm going to start pushing. When I tell you to start counting, count 1 to 15, okay? Bad position is to put pillow or anything under the knee when you're laying down, because again, we want to keep the knee straight.
Within 10 days, I'm walking outside. The fresh air feels so good, I start doing it on a daily basis.
Don't be afraid to put weight on your right leg, and do not put too much weight on your crutches.
Meanwhile, a home care nurse is taking care of other needs, including pain control.
We always say, try to take your pain medicine, because the whole purpose of physical therapy, as you know, is to get you moving. And moving it, you're not going to want to do when you're in pain.
She also discusses signs of infection.
Signs and symptoms of infection is what we really are concerned with. And those would be fever, redness, swelling, drainage, and sometimes maybe even an odor.
Knee surgery is one of the times when it's important not to cut back on prescribed narcotics. That's because it's often painful to get full extension and flexibility. Without mobility, scar tissue can develop, and that could require another surgery, something I'm trying to avoid at all costs.
How hard is it?
Hard. Yeah,
Very hard.
I feel pain in the knee.
I'm also concerned about the extensive bruising on my surgical leg, something the nurse assures me is normal.
It will subside, it'll start from dark and fade down, but it's very common.
The surgeon did 2 sets of stitches, one internally, the other with this set of staples. 2 weeks after surgery, all 33 staples had to come out. I was warned to take pain medication beforehand. The first staple removed hurt, but it was manageable.
That one hurt.
But the 28th staple was a real doozy.
I definitely want you to take another 500 Tylenol.
That
The
needs
pressure's
something
a
up.
little high.
Yeah.
There you go. Good leg first.
I returned to work 6 weeks after surgery, all the while continuing outpatient physical therapy for several months, working toward my ultimate goal.
For me, I'm a dancer. That's what I
do on
Yeah.
my rec time. So how long do you think somebody?
I think you're going to do very well, and I think probably in the 4 to 6 month period you'll be doing some of that.
And as a post note, it's been 10 weeks since the surgery and I've progressed quite well, according to my physical therapist. Just a few more weeks of therapy to go. Hopefully this series helps others who may be considering a total knee replacement in the future.